most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we're the
therapist.
most famous physical therapists on the internet.
In our opinion, of course,
Wow,
Bob.
Brad. Today we're going to talk about how a single finger can help neck turning pain and stiffness. Most of your neck, I mean, this is going to be a surprise to you. A lot of your neck turning occurs way at the top of your neck.
Yes.
And that's why a single finger is going to work. But we'll get into that. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media channels and our website because we're always giving something away.
Yes.
Go to bobandbrad.com, go to the giveaway section, or go to Bob and Brad on Facebook. It's pinned to the top of the page. If you want a short version of Brad and I, where we don't ramble on, go to our Twitter feed or go to our Instagram. So what are we giving away, Brad? Just real quickly.
The
Oh, God, you don't even remember what it's called. Vibrating peanut massage ball.
And it was really a nice device to get those muscles loosened up. And boy, does that thing ever vibrate. Look at that. You can take it to parties if you want.
Yeah.
And there's a dual, multi-task.
Yeah, and it works like, I think it's like 3 hours on a charge. This thing it's a really good price. It's like $30.
Right.
With all their coupons and stuff. So let's go to work, Brad. Do you want to turn that thing off?
It's got its own mind.
Yeah, it's gone. So, all right, I'm going to go to work while he's doing that. So if we look at the spine, and this is orientated like this. So if you look, you got 7 vertebrae that make up the cervical spine. The top 2, we have the atlas and the axis. Just like the atlas, that you would have for geographical.
Right.
You have the axis.
Yes.
Well, you have the atlas and the axis. This has a little point that goes up and this rotates around it. But anyway, 60% by some reports, because I've seen different research that showed 40%.
How do you measure that accurately?
60% of your rotation occurs right here.
So when you turn your head, the rest of your neck could be stationary. And you're
almost stationary. A lot of movements coming from here.
Right.
I imagine some movements coming from there too, but the vast majority is coming from that area.
Right.
So when you have pain when you turn your neck, that's the first place we look. That's the first. So, and what you can do, I might as well show this right away.
Right.
You can take your finger and you put it right on this big wing that's coming out here.
Which is not the number 1 vertebrae, right?
Right, the number 1 vertebrae. You put your finger there and then you turn. And when you turn.
Here, I'll turn the head.
Yeah.
You put your finger there, Bob.
I'm holding that joint, I'm holding that vertebrae. And what happens, they'll be turning above it and turning below it going on. So if that joint is a little sticky and it's causing pain,
sure,
that'll loosen it up.
Right. So it's just what we'd call a mobilization.
Right.
And a gentle one.
A gentle one, yes.
Right.
And we're going to give you some of the precautions here. Now, the reason I'm bringing this up, by the way, it happened to me. In fact, I was just every time I would turn to the left, ow, 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 ow. It just hurt. I mean, and it was kind of dangerous because I ride my bike.
Yeah.
And you got to look over your shoulder. I don't have those mirrors like you do. Don't you have sensors and stuff?
I have radar.
Radar, yeah. And so I got to look over my shoulder to, make sure a car's not going to take me out.
Well, you got to be careful.
Yeah, and I was hurting every time I turned, even when I was running at it. So all I do is I take the one finger. I'm going to show you how to do it in a minute. I put it in place here, and I turn, and I hold it, and it actually feels good. And
you did this while you're running?
No, not when I'm running. Before I run. And when it's done, it actually takes the pain away. For a while, then I had to redo it. But I did it for a bunch of days, and finally it's gone now. So,
but you didn't invent this.
No. This was Brian Mulligan. He's a physical therapist. I think he's still alive, isn't he?
Well, he's getting up there.
Yeah, he's getting up there. Brad and I actually got the opportunity to see him. He's from New Zealand. Quite a guy. Quite a
he's
personality,
a character, but he's fun. He's a good speaker, unlike us.
Yeah, and so he came up with this idea, and I'm going to show you a different way to do it too, like the way that he teaches it. But there are certain people we don't want this to try. I want you to try this on. I don't want you to do it on children.
Right.
I don't want you to do it on the very elderly.
Right.
Because a lot of them are going to be osteoporotic. They're going to have osteoporosis. We don't want to be pushing on a bone.
Right.
In that instance.
Right.
Rheumatoid arthritis, the ligaments can get real loose, and you don't
Sure.
want to be messing with it. If you're on steroids, or if you had neck trauma, meaning that you were like in a car accident, a whiplash or something like
Sure.
that, I don't want you messing with that.
Or
So
surgery. if you had surgery?
After surgery, good
Right.
point too. I wouldn't do it either. If you even have any, like if you move your head and you feel giddy and sick and you got visual disturbances,
Yeah,
that might be something
red
else.
flag.
So
Don't do it.
yeah. So the first rule of thumb though is no pain should be felt whatsoever when you're doing this. I mean,
You're just stretching a
you're
little
just
bit.
stretching and it actually feels good. So I'm going to show, can I sit on that maybe, Brad?
Oh well, that's why I got it here.
Yeah.
Getting it
Okay.
warmed up for you, Bob. There you
There we
go.
go. So if you look at the base of my head here, I'm going to go right down into the center. This is where the skull meets the neck,
Yeah.
the suboccipital area, we call it
Yep.
here.
You can follow that bone, the occipital
Yeah.
bone.
So this is right in the center.
Yep.
If you move over about an inch, you're almost behind the ear, but if you move over about an inch, you'll be there. I mean, and you just hold your finger there and you hold it. So I'm pushing in and then I turn at the same time. I go on the side where you feel the pain. So if I feel the pain on this side, I'm going to go 1 inch over and I'm going to turn towards that side. So if the pain's on this side and when I turn it's on this side, I'm going to go 1 inch over, turn this way and hold. And I do like 6 repetitions and then I don't do any more and I just see how it felt.
Right.
Does it feel, I don't do any more until the next day.
But
And
you might feel increased range of motion.
you might feel increased range of motion. I teach our assistants to do this on our patients, and
Sure.
we measure first, and then we have them do it. And almost always, there's a little bit more range of
Yep.
motion and less pain. So,
I mean, I hate to discredit your title, but you could use 2 fingers if you wanted to get more
oh
support.
yeah,
One on
absolutely,
top of the other.
yeah,
Because I know that's what I like to do. And the same thing and get in there.
absolutely right, Brad. 2 fingers might give a little more,
Maybe we'll have to
support.
change the title.
Now we got to change the title. 2 fingers can help neck turning pain, but you can also actually use a belt, and I'm gonna show it that way too. This is how Mulligan teaches it, but he teaches it with a towel. And
Yeah.
I find that the belt, like a leather belt, works better.
Because it's
Just
kind of grabs to the skin and it
you
makes
probably
it-
start to tremble when you see this because I bet your old man took this to you a few times. didn't he?
Well, I didn't want to go there. I was getting a little shaky when you pulled it out.
All right, so I'm gonna try to miss my mic here, but so you're gonna put it right on the base of your head, right below the skull, kind of where your finger was supposed to be. Now, let's say I want to turn to the left. You're gonna drop this one down. Don't go like this.
Yeah.
Drop this one down, and this one's gonna come across, and it should be up about by your eye.
Sure, is that the maxilla
Yeah.
bone?
Maximal and mandible. Yeah, it's maxilla, I believe.
Yeah.
So anyway, or the orbital.
Ah,
yeah.
we don't do a lot
Yeah,
of therapy around the
yeah.
eyes.
Okay, so anyway, I'm holding this one down and I'm pulling this one across and just giving a gentle stretch, and you're gonna feel again the stretch back here, and again, it should not be painful.
Right.
It's just another way of doing this. Again, you can do the same number of reps, like 6 the first day. If it feels good, you could in the next day you could do it up to 3 times a day,
Sure.
and that's what I was
So you
doing.
just do it the one direction, or can you do it both?
Well, if it helps in the one direction, there's no need to go the other way. Yeah.
Assuming that was already normal.
Right, if that's already normal. But
Right.
generally, there's one that's worse than the other,
Sure.
and so it's a great little technique. Give it a try. Again, let's be safe here. Don't go crazy with it. Try it 6 times. 6 repetitions the first day. Wait till the next day to make sure it didn't make things worse or something like that. But
Right.
generally, if it doesn't hurt while you're doing it, it's not going to make it worse.
Right.
So, some of us still have old cars that we just can't look in the screens, and I have to look back yet. So
Yeah, exactly. Well, those screens are going to make people lose range of motion.
they are.
Over the next decade or
Yeah,
two
that's-
as
that's
people
it.
age, man.
There's no reason they're going to have to look back at all. They're
They're,
gonna just-
yeah, they're going to have
and then the cars are going to drive for them. So then they really,
right.
so
Yeah, fall asleep while you drive.
yeah.
All right.
All right. Thanks everybody for watching.